749-7000, 1-800, the big one. You think we got problems here in Cincinnati. In Indianapolis, it's shaping up like maybe a full year of Kerry Collins at quarterback. Peyton Manning, another neck surgery late this week. And he is out at least 2 to 3 months. So you're talking maybe as late as the early part of December. It was an intricate surgery. I actually asked, I think we got him on the line now, one of the doctors from Beacon Sports and orthopedic medicine, Dr. Ian Rodway, who is familiar with this type of surgery, does it quite a bit. Now, he's not familiar with, and Doc, I think we need to point this out, he's not familiar with the surgery itself that was done on Peyton. He didn't do the surgery, but he understands what the surgery is all about. So I want to, just for a couple of minutes, visit with him and find out exactly what Manning may be looking at. And we've tracked him down, Dr. Rodway, actually at a Dropkick Murphys concert. Really, a Dropkick Murphys concert? How'd you arrange that?
Yeah, no kidding, and at Fenway Park, no less.
Wow. How'd you maneuver that one?
We got lucky. We knew they were coming up here, and we're able to get tickets. They sold out in about 10 minutes, so we got lucky.
Good for you. You're familiar, I'm sure, with Peyton Manning's second surgery, which occurred on Thursday. From what I'm told, that was basically a fusion where the disc was taken out and a piece of bone graft was put in, and they basically fused two vertebrae. Is that correct? And what was that supposed to take care of?
That is correct. His first surgery was most likely a posterior approach from the back, where they just opened up around the nerve. Now, the idea there is to free up the pinched nerve that was giving him the arm pain and weakness, but sometimes that cannot fully decompress the nerve the way you can by doing a fusion. So with the fusion procedure, they went from the front, they removed the entire disc. They're able to remove the disc that is pinching on the nerve. They're able to remove the bone spurs that are pinching on the nerve. And then by putting the graft in, you're actually creating more space for the nerve also by spreading the bones apart.
Well, so I guess the average Indianapolis fan would ask, why didn't they do that in the first place?
And that's, that is a good question. That is the one-and-done procedure, typically, but it does have a longer recovery. And in a contact sport, such as football, you have to be concerned about the fusion and giving it ample time to heal. So the posterior procedure, just freeing up around the nerve that he had back in May, gets him back on the field sooner, but does not necessarily give him the complete relief that he'll get with this one. And so I can see that when presented with it, we tried the surgery, we get you back on the field sooner, less recovery, but it just didn't get him there, and that took him to the next level. And
in normal cases, I mean, this is a fairly common procedure, I would think. Recovery is pretty. The recovery chances are very good.
Very good. Greater than 90%.
But that's for guys that sell insurance and drive trucks and are on television and maybe even other doctors. What about for a football player? It sounds like it's a little bit of a dicier deal.
Yeah, that's why, they often go with the posterior procedure first. Again, quicker recovery, less time off the field. But, the surgery from the front, the fusion surgery that he had is a very good tried and true surgery. And after a one-level fusion surgery like he had, you can be cleared to play contact sports, football, for instance. But you do have to wait that 3, sometimes 6 months for those bones to grow together before you can get back on the field.
Yeah, see, that's when they said yesterday, or I guess maybe even on Friday, they first said it, that it would be 2 to 3 months of recovery time. I talked to some people right after that, and they were telling me, and again, they weren't professional football players, but they were telling me he'd be lucky to be out of a neck brace in 3 months. I mean, 2 to 3 months sounds like a really short time.
Well, I disagree with the neck brace. People don't use neck braces when you're doing a fusion procedure. That's plus minus, but in this is the most common procedure I perform, and we only use a neck brace for comfort for 2 weeks. People feel great after this procedure, and people who are not doing contact activities go back to work sometimes within 2 weeks. But the concern him is not how he feels. It is taking a hit when that bone hasn't grown together yet. And that's what keeps him off the field the 3 to 6 months.
So the arm weakness that he was experiencing, his inability to throw the ball downfield with any authority, what you're telling us here, doctor, is probably this took care of it. I mean, there's an inordinate amount of chance that this took care of it, correct?
There is a good chance. Now, weakness can be permanent depending on how weak he was and how long he was weak. But once you get that nerve decompressed, that gives you the best chance of getting all your strength and sensation back and having that arm pain go away.
Dr. Ian Rodway, he is with Beacon Orthopedic Sports and Medicine, a lot of locations around the greater Cincinnati area, well known from his time with Channel 5 and Call the Doctors and Mind and Muscle and all kinds of neat stuff like that. Doc, thanks for your time. We appreciate it.
No problem. Thanks for having me.